Hi everyone.
Hiya.
Randa's with me today. It's a clinical day which is usually really jam-packed, if I'm honest, but and with less than no time to spare. But I currently have a bit of spare time because of what's just happened, which I wanted to share with you guys because there's some interesting learning in it. And basically what it was a patient I saw 3 years and 1 month ago who loved her result. In her mind, it was just a perfect experience. She wanted to come and basically top up the area that she had treated, so that she got what she came for the first time again, which is great. However, when I looked at her, I realized straight away that I couldn't repeat the procedure, and it's because she's one of these super long lasting people with dermal filler, and she basically hadn't lost any volume since her treatment. It was a non-surgical rhinoplasty, and she's consented for me to show you the pictures. They're cropped, so I'll show you those in a minute. But the interesting thing is, why does filler last a really long time in some people, and is that always a good thing? Because actually, I've realised quite a long time, I realised it isn't always good. Mainly it's good. So if you're someone who happens to get a long time out of your fillers, you're probably just lucky, and it will stay that way. But there are certain parts of the face where it doesn't always suit, and it's just worth knowing about that as a clinician, so that you can make sure that you guide your patients, which is what I did today, which is why I haven't done a retreatment on her. In fact, we decided after a lengthy chat to actually high laser procedure, and I'll show you why in a second. Here are my thoughts on why some people just seem to last a lot longer than others. I mean, there's lots of variables, as it is with all these things, but one of them is it can be your own metabolism, and that means your own enzyme. So we actually all have natural hyaluronidase in our tissues, but we all have different amounts of it. So some people will have more of it, and some people have less of it, and that affects how long any procedure lasts. There are a few percentage of people who break it down in a matter of weeks. They're really disappointing to treat. And the biggest one I've ever had was someone I did a 12 mil treatment on her, looked great, a month later, gone. So because of the way I think about adding value is a really important part of my business, I don't like to, there's no way I was going to make a profit out of that. So we looked after her in that way, but very disappointing for me too, very expensive when that kind of thing happens and you don't get anything for it. But on the other end of the spectrum, there are people who just don't seem to have much of this enzyme at all, and it will just last and last. And my theory is there's some degradation of the product, but just a little bit of it, almost maybe it's time related. And as these long chain dermal fillers break down, they form smaller fragments. And any sugar, which is what the hyaluronic acid dermal fillers are, that is a small fragment, is more soluble than bigger fragments. That's why glucose is really soluble, and the starch in a potato, for example, is solid. They're all the similar molecule, just in different length chains. So those little chains, I think, naturally are more hydrophilic. So as filler breaks down, if it happens very, very slowly, you get increased water attraction. And if it happens slowly enough, then patients don't even notice it. And they just think sometimes they it might be parts of the face where it's actually not a bad thing because you're just retaining volume. But in sensitive parts of the face, like noses, tear troughs, sometimes lips, you lose definition and you add volume. And that's exactly what I saw on this patient today. So she'd had 1 mil of voluma 3 years ago, very happy with the result, came back because she'd noticed a little dip in her nose return, but actually I think what she was seeing was the transition point between filler that was actually getting a little bit fuller and her normal nose structure. And let me show you what it looks like. So if you can see on this image, the gap between here and here is significantly more. This is the after picture. So I had done a non-surgical rhinoplasty on her. She was really happy with that result, thrilled with it. We left with her looking like this, and 3 years later she came back looking like that with this extra wide bridge. So I think this is something really worth knowing about. I'll post that picture underneath as well. It's really worth knowing about, so that you maybe can build into your consent process that if you're one of the people who lasts a very long time, it might be better for you to have a retreatment, possibly reverse it or massage it. It could be on the cards. It's not to say we promise this will happen to anyone, because actually it's quite rare. It's very rare actually, but it's worth knowing about. And then you can make sure you get a really good result. Because if I just retreated her, and this is my fear actually, I think it probably up and down the country, people will retreat and they'll try and, that old saying, if all your if all your tools, if the only tool you have is a hammer, then all your problems look like a nail. It can be a bit like that with dermal filler. Someone comes in, they want a retreatment, they want something better. You end up putting more filler into that, and you're going to disappoint yourself. And most importantly, you're going to disappoint your patient. So think about, sometimes, years after treatment, it might be worth putting a little bit of hyalase in to take that product out, or at least a very vigorous massage or a routine of massaging at home is another option. But I'm interested to hear your thoughts, what other people think about this. Do you think we should be starting with a clean slate every 3 years if you've had a treatment that lasts and lasts? My concern is, if you're doing bigger treatments and this is happening, you know, we need to be referring back to photographs and just checking that the volume's definitely gone, and you're not trying to get definition back on top of a hypovolemic state because the filler is breaking down slowly, because that's just a recipe for pillow face, basically. So anyway, that's my thought for today. Let me know what you think, and I will try and answer any questions that come about tomorrow. But I just thought it was quite an interesting thing. We don't often think about what happens when filler just lasts and lasts. It isn't always a good thing in terms of the aesthetic result, although she's obviously had at least 2 years of it being good. I think in the last year it got slightly worse and a little bit puffy. So let me know what you think. If you think this is useful, tag someone who might find it interesting, or you can share it. And most of all, I love reading the comments, and if you've got other questions or things you're wondering about this topic or any topic, you can message me or write in the comments, and I really appreciate that. So thanks for watching. I'll see you guys probably tomorrow. Ryan's going to wave goodbye.
Bye.
Bye guys, thanks for watching.